Welcome to everyone who's here. Thank you for coming. My name is Suzanne Stewart, and I am the director of the Waakabeness-Bryce Institute for Indigenous Health Research. And I'm here today to introduce and host my colleague, Dr. Angela Mashford-Pringle, who is the Associate Director of the Waakabeness-Bryce Institute for Indigenous Health Research, in launching this amazing report that she has written and led called What We Heard, Indigenous Peoples and COVID-19. I'm very excited about this. When I first heard that Dr. Mashford-Pringle was working on this, the first thing I thought is there's no one better in the world to do this than she, because she's patient and understanding, able to interface with government in a good way using our Indigenous knowledges, and is able to write academically in a strong way that makes sense to the policymakers, but also makes sense to our people and comes from the heart. So I'm very honored and humbled to be here, and I'm grateful to everyone who's joining us today. And I'd like to give a shout out to Roy Strebel, who is the Ontario NEAR coordinator, and to thank him for setting up the meeting technically, and to be and for being here to be the technical troubleshooter should we have any issues. Normally, if we were in a in-person format, I would invite people to introduce themselves, but I don't think we have time to do that with the high number of participants we have today. But I would like to ensure that everyone knows that they're welcome and that this is a safe and open space, as well as to mention that we have an elder in residence here at Waakabeness, and that is knowledge keeper Clayton Shirt, but he is having technical difficulties in logging in. So for the sake of expediency, we're going to invite Angela to introduce herself in more depth, as well as to share her amazing report with all of us. So Angela, it's a pleasure to have you here, and thank you again for making the time to be here to celebrate this wonderful accomplishment of bringing our people's voices to the government in addressing the COVID-19 pandemic. And here's Clay.
Give him a second. I love it.
That's amazing, Clayton.
I love that. I don't know if he can hear us yet. While Clay is connecting, I will introduce myself. So I'm Angela Mashford-Pringle. I'm from Timiskaming First Nation in Northern Quebec, but I was born and raised here in Toronto. As Suzanne, Dr. Stewart has already said, I am the Associate Director of the Waakabeness Institute for Indigenous Health at the Dalla School of Public Health. I'm also the Indigenous Health Lead for the Dalla School of Public Health. And I'm the Program Director for the MPH in Indigenous Health. I'm a mom of two. I've been married almost 30 years. We've been together more than 30 years. We haven't quite been married 30 years yet. I have two wonderful adult daughters. One is upstairs taking her PhD classes, and the other one is out on an audition. So my kids are always busy. And then I have fur babies, which you might hear because my 8-month-old bloodhound is a little bit upset because she can't go run around in the backyard today because of the ice. So that's a little bit about me. I'm Bear Clan. My spirit name is Agijigejik, which means eagle cradling spirit. And I'm going to see if Clay can hear us. I don't know if he can or not. Uh-oh, but we can't hear you, Clay.
So Clay, I don't think we can hear you. Perhaps we should let Angela begin her presentation.
Oh, there.
I hear you now.
Can you guys hear me now?
Yeah, we can hear you now.
Woohoo, yeehaw.
Okay, I can't hear you guys now. So
It's called
The
human
joys of technology.
communication.
I don't know what's going on here. There's all these different settings. All right. I apologize, guys. Okay. Hello?
Hello.
You hear me now?
We can hear you. Yeah.
You can see me now?
Yeah.
All right, then. All right, I'm here. Just all these settings. I'm sorry, guys. It's my computer. Yeah.
Wonderful, wonderful. Well, we'd like to invite you to introduce yourself and do our spiritual opening. That would be amazing. I put some tobacco down for you this morning.
Okay. Thank you, Miigwech. So
Good.
we're all here. All right. So I just introduced myself. Again, my humble apologies. Technology, you know, it's great when it works and it's horrible when it doesn't. So with that, on that note, I just want to say Miigwech, introduce myself. My name is Clayton Shirt. I am the traditional knowledge holder / elder at Wapampinez. I've been here for a number of years, I think 4.5 years now. It's been a wonderful experience. So they asked me to come, and I've been doing this quite a while on Zoom. And traditionally we would be together. So what we're doing here is a virtual circle. So in that virtual circle, they asked somebody like myself, an elder or knowledge holder, to do an opening prayer. And it's been challenging, but we've been doing this for a number of years now, and I'm getting quite okay with it. But I would love for us to been all together, and just picture in your own minds, we're all in a circle, wherever you are, we're in this circle, and that's Indigenous thought, and everyone is the same in that circle. It's just one person is asked to do the opening prayer to invite spirit into that circle. And it's a ceremony. It's a very basic ceremony. And so that tobacco is given to that person. Tobacco has been given to me. And so I'll do this opening prayer. And we take the time and we just breathe, I like to say, take a breath and gather our thoughts. And with that, I just want to say Miigwech. I say thank you. I say thank you to our first mother. I always like to acknowledge our first mother of all mothers, our mother, the earth, again, for providing everything for us to sustain life. Again, I pray to her. Again, I pray for her in gratitude for everything she provides for us, the medicines, those 4 sacred medicines, and all the medicines she provides for us, the food to sustain life. I say thank you to our first mother. Again, I love you. I say Miigwech. We send our prayers to you in gratitude for everything you do for us. So with one mind, one heart, I say Miigwech to you. I offer my prayers to Father Sky. Again, I ask the spirits of my ancestors, your ancestors, to be with you in these difficult, challenging times, to give you strength physically, mentally, spiritually, emotionally, to give us strength. We come together in this circle to pray, to give thanks for the people. May we always have this in our minds and our hearts, why we are here, why I am here, to work for the people. This is why we're here. This is why we ask you. This is why we partition to our ancestors, to give us the strength, the guidance, to clear our minds, to open our hearts just a little more. I say Miigwech. I humbly ask the spirits of my ancestors, your ancestors, wherever you are, to be with you. We come together with a good mind. We say thank you. So with that, I say all my relations to Father Sky, that spirit world. I say thanks. I give thanks. I say Miigwech to Grandfather Son for giving the appearance of rising in that sacred doorway, that one doorway, many doorways, but I acknowledge that eastern doorway, that one doorway, for giving the appearance of rising, a new day, a new beginning for all of us and our relatives, for bringing the warmth, for bringing the light, for making the medicine grow for us, the people and our relatives. I say miigwech to you, grandfather, son, for this. I love you. I say miigwech. And if I have done anything wrong in the past, I have this moment, this day to make it right. And I am so grateful for this. I say thank you, grandfather, son, for this day. So with one mind, I say thank you. I offer my prayers to Nukumis again and again, grandmother of all grandmothers, Grandma Moon. Again, you are so beautiful in the night. I send my prayers to you. I pray to you. I humble myself. I say miigwech to you, Grandma Moon. I love you. I say miigwech to you for everything you do for us as we all sleep, as our children sleep, as our babies sleep, as we all sleep, the people we love, the people we cherish. We all sleep. You do this for us. I acknowledge this. We acknowledge this. For you put the waters, the rivers, the lakes, the oceans into order for us. For water is life. I acknowledge this. I remember at this moment the sacredness of water. I have forgotten so many times, but at this moment I remember. And I love you for this, Grandma, for doing this for us, the people. And we always have this in our minds and our hearts. You think of us, we think of you, Grandma Moon. You are so beautiful, and all the work you do for us. So many things. So with one mind, one heart, and gratitude, I say miigwech to you, Grandma Moon. I love you. I say all my relations. I offer my prayers to you, Creator. Again, I ask you to have pity on me, that I forget so often that I am an Anishinaabe before I'm anything else. And at this moment, at this time, I remember this in my mind, in my heart, for I am an Anishinaabe, and I thank you for this, for making me an Anishinaabe. And I say thank you for this gift you have given us all, life, the sacredness of life. I say thank you again, Creator, for there is nothing beyond you. I say thank you, Creator, for this beautiful gift you have given us all, called our lives. I ask for the blessings for all of us. I cannot see them, but I say I ask for the blessings for all the people who are here. May they have good health, a good mind, a good heart. May they say good things today. I say thank you, Creator, for this beautiful gift called life. Thank you, Creator. I ask for the blessings for all of us today. I say all my relations, Creator, I humbly say miigwech to you for this beautiful gift. I say thank you, all my relations. Miigwech, miigwech, miigwech. Thank you for allowing me to say that simple prayer that I try to live by every day of my life. And I thank the moments, and I fail miserably at it constantly, but I thank the people who allow me to be here and to say these words and to remind myself why we're here. May we always have this in our minds and our hearts, guys, why we're here. May we always put the people first. So with that, I say miigwech to you. Thank you for allowing me to say that prayer in this language. So miigwech.
Merci Cho, thank you, Clay. That was beautiful. And now we'll turn it over to Angela so she can begin to share with us. Dr. Mashford-Pringle, that is. My apologies for the informality.
It's okay. We know each other, so it's okay.
Just before you get started, a few housekeeping items. Dr. Mashford-Pringle, are you open to taking questions towards the end? Okay, so I'm gonna make sure to stop you around 10 minutes to noon, and then invite the audience to write questions in the Q&A if possible, please. And then we can answer those questions at that time. And also there will be a feedback survey posted in the chat. And I would really implore everyone to fill it out so that we can get your feedback to continue to improve our webinars and meet our audience's needs. Merci Cho.
Okay, so last year, or no, oh my gosh, it's 2 years now. In July of 2020, the Public Health Agency of Canada, the Office of the Chief Public Health Officer of Canada, which is Dr. Teresa Tam, had approached me to write this report. And they said, oh, we've already got a meeting scheduled, and we're going to, we just need you to listen and write up notes. And I said, sure. At the time, and I know at least two of the people are here, Christine Skura, Sterling Stutz, and Thalaxi Yohathasan were all MPH Indigenous Health students. And I asked them if they would help me with this report. And so we listened in on the day that they had. And unfortunately, there was a lot of presentation, but not a lot of time for community members to talk. And so we ended up having to do a second day where we had community members come. We had 65 people, and we broke out into small breakout rooms, and there was a number of people that helped us with that. And people were asked a few pointed questions so that we could get to how COVID was. So remembering back in September of 2020, we didn't have vaccines. We didn't know what was really happening. We knew people were getting very sick. We knew it was spreading very quickly. Masks were still hard to come by. People were making their own masks because we couldn't buy medical masks or N95s. So think of the context as I go through the report with you, because I think it'll make it easier for you to understand. So Health Canada only thinks of our health in a very specific way. So they have the absence of disease, but they use these 12 social determinants of health. So if you look here, you'll see things like gender and financial or social status. You'll see things like healthy child development. And these are all very important pieces. And I think that we need to be looking at these. And I think COVID made it very, very apparent that some of these things are not equal for different people, and Indigenous people in particular. So First Nations, Inuit, and Métis peoples don't have these 12 core determinants of health in the same way that other people do. So why am I telling you this? Well, because that brings us to the next part. Hold on, my computer's not listening to me. Oh, there we go. There we go. There are other determinants of health that we not only heard in this report, but have been heard in other reports as well. So colonization has had a huge impact on First Nations, Inuit, and Métis communities and peoples. And we haven't really discussed how that has played out, but you know that it has led to trauma, it has led to poverty, it's led to people migrating out of their traditional territories for work, school, and other events. It has disrupted our cultural continuity. It has undermined our self-determination and our self-governance. It has clearly changed things with having the internet, because now we're globalized. So obviously people could be anywhere today when they're listening to me speak. And, you know, it's really changed a lot of things. What it hasn't changed, though, is it hasn't changed who we are fundamentally. And it has made us vulnerable. It has put us in places where we don't have control over the systems. And I think that that's the most important piece. So if you put all of the determinants that I'm talking about, the 12 that Health Canada created and the Indigenous social determinants of health, you'll see all of these things together. And I think part of it that doesn't get really discussed is like access to health services. So you'll see when I start talking about some of the recommendations from the report that they were kind of left out of the planning in the pandemic. And it's important to think about these things and to think about healthy child development, not so much just from the mental health perspective. I know everybody's arguing, oh, I need my kids to go to school, it's bad for their social well-being, but that may not necessarily be true. I'd love to see the evidence on that, because, you know, 100 years ago, if we were talking in 1910, 1920, not all children went to school, and specifically not all First Nations, Métis, and Inuit children went to school. And so having that is a different way of thinking, right? But we did lose our social support networks. So we weren't able to do the things that we normally do. However, we did hear from a lot of community members where they came up with some really, I think, creative ways to stay in touch with each other. So they had the Pass the Brush TikTok challenge, where you were to make a video with your friends where you put on your regalia, and the brush comes up to the camera, and then it flips to another person. And so I think that was creative. There was flag systems in some communities where if somebody needed food or water or something else, different colored flags were hung on their door or on their porch, so that community members who were going around and just checking every day could tell if you needed anything. People were trying to figure out how to have 20 and 25 people in their houses, as well as have isolation. We also know that the physical environment, because COVID happened in March of 2020, that's when we started, there was, the winter roads were starting to come to an end. There was no time to get extra shelter up into the community so that people could leave their home and isolate in a space where it was just for isolation. And we heard that clearly, that this is something that all the communities needed. Is they needed some kind of community center or an extra building in the community where they could have people go. And then what about they also have populations that are homeless who may couch surf, or who, just live out in the bush and come in periodically to the community, and they had no place to put them, and they couldn't test them because they didn't have test kits like we did in the South. And this is primarily for remote and rural and isolated communities. But, that also meant we had a number of things happen as we were writing this report, and just after we were done writing it and waiting for it to be published. We started hearing about Inuit women who were pregnant that had to be flown out of Nunavut, and they were flown into Ottawa. They had to stay in a quarantine hospital for 2 weeks with no help or support, because they couldn't have anybody because of COVID restrictions. And so they sat in a hotel for 2 weeks waiting. Then hopefully they went into labor at that point, had the baby, and then they were put back in the quarantine hotel before they could go back to their community. But in the time that they're at the quarantine hotel, they weren't all allowed to leave to go get food. So food was dropped off to them, and a lot of them were telling us how the food wasn't good. And it certainly wasn't home kind of meals. It wasn't things that they were used to. And it precludes them from being able to do any of their traditional practices around birth. And this is not just because of COVID, but COVID made it worse because they couldn't have somebody else with them. So imagine trying to give birth for the first time when you're with nobody. Imagine coming down for cancer treatments to the South and not having anybody with you. And there's limited Indigenous patient navigators for cancer across Ontario. There's only 10 of them. So not having all of these things also put us in a more vulnerable position than we had been previously. So the impact of the social determinants is, oh my gosh, now it's going too fast. There we go. The impact of the social determinants of health really came down to resourcing, funding, human, physical, and that, this inequality was always there, but COVID made it that much more visible. Not that it was ever invisible to First Nations, Métis, and Inuit peoples and communities, but it became more visible to everybody else. So again, remembering this report was written nearer to the beginning of COVID. So we finished writing in November, early December of 2020. There's 15 recommendations. I'm going to talk about them, and there's a number of key themes. So sovereignty was a big issue. People were talking about how come the governments could close down the borders at will, but they wouldn't help First Nations to close down their borders. So in particular in Ontario, in the first shutdown in March of 2020, everybody shut down. But then when June rolled around, the Premier, Ford, opened everything up, including that you could go anywhere you wanted within the province as long as you maintain social distancing and other public health measures. But some of the First Nations weren't ready or wanting to open their doors. And so they were finding people who were coming across to their communities by boat, driving past any barricades that were near highways. And they were just coming simply into the community and strolling about when, they were already living in fear. And so we made mention of this in one of in the sovereignty key theme, and that we had no control over when the borders were open or closed, both the US and the First Nations or community borders. And this is important to know. There was a problem with kinship because you couldn't meet up with your kin. Obviously this was for everybody, but it really did have a huge effect on trying to do cultural revitalization or language, because you can't really do it the way that it is. We found that while people were able to access the COVID funding, in some cases that led to further substance use, and in some cases it led people to feel too isolated, which led to a string of suicides in communities, and that that just leads to further harm and trauma. Since writing this report, we also had the finding of the graves. Not that we didn't know as Indigenous people, but other people didn't know. So we started to hear about that, and that also plays into mental health. And while we had already written the report, similar things were said about residential schools. And if you think back in history to Indigenous history, you'll see the past system where we were forced to stay in our communities and we had to get permission to leave. And that was causing problems for some people. They felt like this was another government way of coming down on Indigenous people. We had community leadership for the most part, but the problem we were having is they weren't prepared for a pandemic. They'd been talked to after different pandemics, but there wasn't enough preparedness or for an emergency, because both happened. In some communities, they not only were facing COVID, but they were facing floods or fires. So if you guys remember, that was this in the summer of 2020, we were having tremendous wildfires in BC and Alberta. And then shortly after that, we were having flooding in the northern parts of Manitoba, Ontario, and Quebec. And so people were talking about that and saying that there was no emergency preparedness for them. We struggled with the next one, mistrust or distrust, and I'll talk about it after, but mistrust of systems, not just healthcare. There's huge structural inequalities, and people are made vulnerable by the way that these structural inequalities happen. The lack of healthcare access, and people are going, oh, but you could access through video conferencing. Yeah, except for we don't have broadband internet access in every community that's sufficient enough to do what we're doing right this moment. The funding, there was huge problems with that. One of the first funding sources came out just before the Easter long weekend in April of 2020, and you had 4 days over the Easter long weekend to put in your proposal to get funding for your community for COVID-19 relief. I happened to be working with the Anishinaabe Nation, and they were struggling to get that done in the 4 days. I imagine, and what we heard from a lot of people was that's not the only instance that happened in, and that was problematic in trying to get the funding that they needed to keep going. The government relationships have always been a problem. This is not a shock. They talked about that at great length, that they aren't engaged, and when they say they're doing engagement, they don't actually mean the kind of engagement that we expect. Land was another big issue. They wanted to know why they couldn't have more land so that people could go out on the land, could live off the land. Ceremony was a huge issue. And there was a big rise in domestic violence at the very beginning of COVID because people were stuck together. This was new. It was harder on them. Communication was not open. It was not clear. And people certainly didn't know what was changing day by day. And I know that was true of all communities, but for Indigenous communities, sometimes it was taking up to a week before they heard anything. And so there was a lot of discussion about, needing to have a clear communication system and what would that look like and who should be providing it. Then the last piece was everybody kept saying, oh, we need data on COVID. We need Indigenous data. But not once did I hear people talking to Indigenous people to find out how data sovereignty would work or what that would actually look like. I still haven't actually heard that. So, this was all a problem before we got to COVID. We had mental health issues of suicide, substance use, historical and continued trauma. And COVID just made it so much worse for us. It just totally changed the way that we interacted with each other, with outside society, with people coming into our communities. People were distrustful of them for a number of reasons. One, did you wash your hands? Did you come in here with COVID? And then there was other issues, like we had a couple of communities where like chickenpox all of a sudden became an issue and nobody could get any kind of relief from the chickenpox virus. So, this leads to mistrust or distrust. I mean, we had lots of conversations about which word to use, because you not only mistrust the organizations and the structures, but you distrust them in what they do tell you. So you mistrust what they're trying to provide to you, but you distrust what kind of service they are providing. So we found that for the most part, there was a lot of issues around mental health, and there was a lot of issues around sovereignty, and people wanted to have more control over these things, and there was getting to be less and less control over them the further into COVID we were going. This was the key point that I think almost 90% of the people said it at one point or another, that the relationships that the federal government has are with the mainstream organizations, but they don't actually have relationships with any communities. So they know the Assembly of First Nations, they know the Métis Council of Canada, they know ITK, then they also know like the regional chief organizations, but they tend to not know every one of the First Nations, Inuit, and Métis communities. Like they wouldn't know how to reach out to that. And what I heard from the government was, well, it's hard for us to get to 633 First Nations. But we weren't 633 First Nations before colonization. We were 70 large nations, which had small little communities within them. And now they're trying to say that they can't do all of that, right? And so it takes time to build a relationship, to be true and authentic, which I heard clearly from talking to people across Canada was, you got to spend more time talking to us. You can't just email us or call us and ask us for information or get us to answer a survey or whatever it is, and then never come back, or come back 3 or 4 years later and ask the same things again. So they said there's benefits, huge benefits for them opening up the tables, allowing individual First Nations communities to talk to government instead of just the big national organizations. It would build mutual understanding, but it would also build mutual respect. And so there was a lot of discussion about how to build this relationship. Every one of the government departments who has anything to do with Indigenous services, not just Indigenous Services Canada, but Health Canada, Employment Services, Development Canada, Heritage Canada, Parks Canada, they all have relationships with different communities. Why can't you build upon those relationships is what people were asking us and what we put into the report. The other big issue was the definitions of what rural, remote, and isolated mean. The reason this became a huge issue was because the funding and what kind of resources are sent to communities depended on their definition. But when you look up at government sites, every one of them has a different definition of what rural, remote, and isolated is. It's very apparent that we need to have one central definition for each of those when it comes to Indigenous people. For example, the Public Health Agency of Canada had one set of definitions for rural and remote. Statistics Canada had a different set. And I believe it was the Auditor General had a different set. So why am I telling you this? Well, if all of the funding is based on how you're perceived as rural, remote, or isolated, then we need to make sure the definitions are the same, because this is a bone of contention when it comes to getting human, material, or financial assistance from the federal government. And when we're talking, just yesterday, we started having engagement on the new distinctions-based health legislation. This is going to be important there as well. So you can't build legislation if you don't know how to decipher between rural, remote, and isolated. I do work with American Indian and Alaskan Native communities, and they don't have any isolated communities, or they have very few remote, which would be in Alaska or Hawaii. And they have a lot of rural, but they don't have definitions either. And this is now starting to cause them problems in terms of funding. So the other thing that was said to us, assistance has to be holistic and it has to be adequate. You can't forget that we have a whole bunch of reports that came well before this report that I put out. We had the Royal Commission on Aboriginal Peoples that came out in 1996. And there's, you know, we've had the Murdered and Missing Indigenous Women report. We've had the Vens Commission report. We've had TRC, the Truth and Reconciliation Commission. We've had numerous reports in plain sight. All of these reports have said that things have to be more holistic. The government has to start thinking physically, emotionally, spiritually, mentally, and socially about individuals, families, communities, and nations. They cannot no longer see individuals as, you know, the population health approach. They can't say, well, we know that X amount of people need this and X. No, because there's other parts to you, right? You can't just say, hey, we need to have more physical activity, but not understanding why emotionally or mentally you can't get to that physical activity. Or maybe you're socially isolated and you have no way to get to doing that. There has to be a holistic approach to things. And that was clear from our discussions. The other big thing that everybody talked about was communication. We've had horrible communications throughout COVID-19. They have changed so rapidly. However, it was even less clear for First Nations people. And why do I say this? Well, if you're in a community that doesn't have clean water and you're telling people to wash their hands, you're actually making a problem probably even worse, because in some communities where the water is bad, they get different skin ailments from using the water. And I was hearing from government people that they should just go ahead and use it. And I'm like, but they can't. It's going to cause other problems. They're like, well, we have no way to get them water, so they're just going to have to use what they have. I think that that's a wrong-headed move. I did put this in the recommendations. This is also something that they were very adamant about, is that they wanted to hear the communications directly from the federal government. The provinces all seem to have, at some point, flipped over to being the voice of COVID-19. But in fact, it was never clear when that happened. And we ceased to see Dr. Teresa Tam talking to us, but rather that we had science tables here in Ontario and across Canada who were talking about what COVID-19 looked like for them. And the communities were saying that that wasn't clear as to who was supposed to be giving the advice or what advice they should be following. They also said that it would have been nice to have proper testing right from the get-go. We were hearing about testing in Southern Ontario and Southern Canada, probably within the first month anyway. A lot of the First Nations didn't get the first round of testing until late April, early May at the earliest. But yet here in Toronto or in Montreal or Winnipeg, they were already being tested. And so there was a lot of discussion about why weren't they allowed to have that kind of testing? And the solutions they felt weren't evidence-based. So remembering that when we wrote this report, vaccines were just a suggestion. We hadn't got to the point where there was a vaccine. And people were worried about the fact that in our history as Indigenous people, there had been a number of times when people have experimented on us without our knowledge, including, you know, forced sterilization, the idea that they you know, did nutrition experiments and many other experiments. People were worried that there wasn't evidence-based solutions for the end of COVID. So they understood that there would be a vaccine, but they wanted to know what the evidence was before they started to roll it out in their communities, for fear that we were going to be tested on. So when people were saying, well, we'll roll out vaccines to First Nations communities first, there was actually a fear to have that happen because of the past. And I don't blame them, but we put it into the report so people understood that this was actually a fear. We heard loud and clear, and I think my team and I were probably the biggest proponents of this, that Indigenous people should have sovereignty over any data collected. This is a huge issue. It continues to be a huge issue. It's not going to go away anytime soon. When you're asking to do race-based health data, that's lovely. You're going to get to know all about different groups of people, but how you use that is important too, right? And right now we don't have a clear understanding of how people will use it, whether it's governments or researchers. And there's a lot of push for people to want to just get in there and use the data for their own purposes. I'm always concerned that there's a deficit-based use of our statistics, and that we have to move towards a strengths-based approach. We heard that from a lot of people, that you can't say, well, hey, you get more diabetes, so we're going to check you for diabetes. They were worried about that happening with COVID data as well. And they were worried that people would say that we didn't have COVID in the same way that everybody else did, or we had it more, and what that would mean or how that would affect them. They also asked that we have basic diagnostics in community, because throughout the first year, people weren't able to even get a blood test because you couldn't fly out of community. They don't have ultrasounds or Dopplers. So if you were pregnant, there was no way to check on the baby. They would have had some blood pressure machines, but oftentimes the nursing station was in lockdown because of outbreaks. And so there was no way for them to check any of this. You know, in the South, you can go to a pharmacy and they'll have a blood pressure machine that you can go check it on. They were saying that that would be nice to have there. There was also the idea, could they do rapid blood tests? You know, not every community has that or should have that, but, you know, having it in an area so people didn't have to go to the nearest city center to get it done. There was also a discussion about having Indigenous public health, which looks out for Indigenous people in an Indigenous way, which would incorporate our ways of knowing and being into public health advice, whether it's public health promotion, it's climate and environment, it was infectious disease, so on and so forth. We would be able to do it from our own way of knowing. And this is something that I think we're all striving to understand. How would this work? And we know that this probably won't be the last pandemic, and this won't be the last emergency situation. So how do we then create an Indigenous public health department or unit or way to do these things? I will say I had started working with Anishinaabe-Aski Nation in March of 2020. I looked at the pandemic plans that existed pre-COVID-19. All of them said that the provinces and the feds would get in touch with First Nations, Inuit, and Métis organizations and governments to let them know how to move through a pandemic. What we saw and what communities were telling us was that's not what happened. Often they were left to the end to be told what to do, and things were just kind of thrust upon them or taken back from them. So the recommendation was that there has to be First Nations, Inuit, and Métis pandemic plans. They can't be one size fits all pan-Indigenous pandemic plan, but rather individual and actually regional, so that we know how to organize amongst different communities. Funding was also a huge issue. There was not enough funding. There's still not enough funding. When other people, businesses and organizations were getting funding, they weren't getting funding. So it's important to have substantial funding for the recovery phase, like now. The biggest thing we heard, I think it was the biggest thing. It was underlying everything else, because you couldn't socialize, you couldn't talk to medical professionals, you couldn't get any entertainment because the broadband internet was put in 2000 and hasn't been changed across Canada. So some of the communities were saying, hey, we don't have cell service, let alone do we have enough bandwidth to be on Zoom or to be on FaceTime or any of those things. So the more people in the community that are on that internet, the less you have. And so they were saying that the federal government had to invest in making a better internet connection if they wanted them to have virtual appointments or to socialize or whatever the case may be, because right now they didn't have it. Because mainstream businesses and organizations got funding, there was discussion about what happens to businesses on First Nations or Métis or Inuit lands, because they weren't always eligible for the same programs and services. So again, that was in 2020. I'm sure things have changed a little bit because there was a lot of pushback then. But they were worried about economic recovery. So how does their community move forward? They were already in deficits for housing, water, education, healthcare. So how would they now move past those deficits, as well as the deficits that were created because of COVID? We know there is racism in healthcare. This was something that was said over and over again, and there was a lot of fear about COVID and the racism. And when Joyce Echequan died, I think it played a huge factor. This was past when we did the conversations, but in some of the reports given to us from the communities, they did talk about that. And then Jocelyn Ottawa died. I'm not even sure if anybody knows who Jocelyn is. But this was happening. It was happening quite a bit across Canada. And there was a lot of concern about racism. Now, we know the In Plain Sight report came out after us. We're well aware that it had a lot of recommendations as well. We're not sure where this is all going to go, right? What has COVID changed? Well, it's for a lot of Indigenous people that were in our circles, they were talking about land and returning to land and remembering that Mother Earth gives us everything. So we have to start thinking about her first, because that will make us healthy and well. They were really concerned about the policies and legislation that the federal and provincial governments run by. They wanted to know how that could be changed to give more equality. And then they were worried that nobody was standing up for Indigenous people, and how do we change that? So I've been working on one of the recommendations that came out of that, which was cultural safety training. So I have the new Respect Cultural Safety program that I'm working on now. There's a ton of recommendations in all of these reports. So you'll see there was 15 recommendations from our report, 440 from the RCAP, 94 from the TRC, 231 from the Missing Indigenous Women, and 142 from the VENS. So just just to say that there's lots of recommendations, but how are we going to get them implemented? And the thing that came across loud and clear is we're stronger together. So the more that we work together as Indigenous people, the more likely we are to make a difference and to actually make change to governments and to our own systems and bring us back to sovereign people.
That was an amazing report, Dr. Mashford-Pringle, and so deep and insightful. And I have a million burning questions. But before I get to those, I'm wondering if the audience has any questions. I would like to again invite all of you to write any questions into the chat or into the Q&A. I see that someone wrote some comments, and maybe I will read those. Racism, faithism should also be added to both and all sets, such as social, structural, systemic determinants.
Yes. I totally agree. I think that the problem is, if you go by the 12 that Health Canada goes by, we're missing a whole lot of things.
Oh, hang on, I gotta get my reading glasses on here. Yeah, and there's another comment. Yes, structural racism. Structural racism is a public health crisis and should be added to the various determinants and adverse childhood experiences, amongst others.
Definitely.
I had a question too,
Yeah.
and I don't know if you mentioned this and I just missed it. So with the people you talked to who were First Nations, Métis, and Inuit, what was the demographics of the people who participated in giving you the data for this report?
I'd have to look it up, but it was primarily First Nations. We had a lot of issue with the Inuit. They felt that we didn't give enough consultation time, which I totally agree with. I'm not dismissing anything they had to say about that. So they gave their report directly to Dr. Tam. So they're not really included in this. We did have, I want to say 3 or 4. We had 3 people come to the meeting, but we had at least 1 report from an Inuit community. So that was the other thing. Not everybody attended the meetings, but some people sent us reports or things they wanted us to think about or include. So they are included as well. So some people had made resources about COVID. They're included at the end of the report. Some people were telling us exactly what you heard here, echoing things that we heard when we were in person. I'm trying to think of Métis. I think it was a pretty good mix, but I don't think, I'm positive First Nations were the highest number, and they were from across the country. So we tried very hard to get First Nations, Métis, and Inuit people from everywhere that we possibly could. And I know that we had a good representation out of BC and Ontario and less in some of the other places, but we got input from the Yukon and the Northwest Territories, even though they weren't in attendance.
So when you say First Nations, so are these First Nations people living on reserve, or are they people living off reserve in small towns or rural areas or in urban centers?
The vast majority were like band council members from their community. So they were in community.
So in the report itself, which I have, but I haven't actually had time to look at it in depthly, is there a breakdown in there of the people who were consulted, who was on reserve, who was urban, what their identities were, just to get an idea of sort of whose voices were being represented in this?
No, because we said we were going to try to keep this somewhat anonymized for them, because some people were saying some, in all fairness, they were as rough as they could be, because we told them to tell us everything. And in some cases, they told us, please don't mention where we're from. So we were struggling with putting that in there.
So yeah, not their specific reserve, but I'm just saying
they didn't even want. Yeah, they didn't even.
Urban. So none of that is in the report. So there's no way to know which voices came out, if they're urban voices or reserve voices, because I think they would have really different things to say.
They did, but even so, we had people who their reserve is close to an urban center. They were saying similar things, but they were more concerned about the closing of borders than, say, the more rural or remote First Nations, because obviously if you're a fly-in, that's not as big an issue. But it was an issue for, like, say, middle of Ontario. There was a few First Nations that were First Nations representatives from there, and they were talking about, people are just showing up anyway. Like, they're just going around our barricades, or they're coming in by boat. And that was happening out west as well, like near the coast. And so that issue was happening across the country, because when people wanted to go to cottage country, that's where Indigenous people are, right? Exactly. And so they were like, yeah, we're just coming anyway. We don't care. We don't care what that's going to do to your community.
Exactly. So we have a couple other questions, which would be great to get to. So how many coercive translation impact outcomes? How may coercive translation impact outcomes and vulnerability? Also subcultural components with assimilation.
Not quite sure I understand the question, but I'll
Okay,
try to.
I'll read it again. How may coercive translation impact outcomes and vulnerability? The translation maybe of, the messages, how will that impact the outcomes and the vulnerabilities of our people?
I think, in all fairness, because communication was so poor, and it continues to be poor, by the way, otherwise Bearskin Lake wouldn't have only got like 4 rangers for 500 people who were sick. Anyway, I'm not even gonna get into that, but the idea is it does have a huge effect, right? It doesn't matter where your community is. Even if you were in Toronto, trying to get Dr. Janet Smiley was trying to get, and so was Dr. Stewart, trying to get vaccines to Indigenous people in the city. And we know that it wasn't easy there. And so it leaves us more vulnerable because we're already in a vulnerable state, right? We're made vulnerable by the systems. So the more bells and whistles and hoops we got to go through to get to something that, is supposed to be ours, the worse it's going to be. So it just keeps compounding.
So 2 other questions, and I think they're kind of related, so I'm going to read them together. How might we enforce policy and legislative system changes and recommendations to ensure their implementation and upkeep? And what has been the response from federal and provincial governments to the report, or is it too soon to tell?
I can tell you right now, they didn't like the language I originally put in it. They forced me to make a lot of changes to that language. It's less pointed because the participants were very hard on the federal government for their response to COVID. It doesn't, if you read the recommendations now, it doesn't seem that way, but it was very pointed. So they had to be smoothed. No response since. The provinces didn't even acknowledge getting it. Dr. Tam's office acknowledged receiving it and putting it out. My class of Indigenous Health and Social Policy all did briefing notes, no acknowledgement to those either. How do we get it implemented? Well, I think the biggest thing is we got to stand together. So we have to stand in a pan-Indigenous way for them to at least see us as a group. And then we can start to move towards, because they don't even see us as a group, right? Like we are so small on the radar of Canada. We're 5% of the population, 7 if you take the newer numbers. We're not enough to make them want to do anything. And while we have treaties and such, they're not interested in doing anything with those either. So the only way we're going to make a change is if we stand together and we have enough allies to stand with us. I mean, if the trucker convoy is anything to look at, they at least managed to get the governments to hear them. Whether they heard them in a good way or not is a different story, but they heard them. And I think that's it. It's just, there's, more numbers, the better.
Absolutely. Well, I think on that note, we will bring this this wonderful presentation of this amazing cutting edge report to a close and say a big hearty thank you, miigwech, merci, to Dr. Mashford-Pringle for writing this report, because it took a lot of courage and strength to do this and to be able to work with them. And that's why they would never ask someone like me to do something like that, because I wouldn't have the patience and the aplomb to do that. I would just tell them in no uncertain terms, and they don't want that. They want someone that can actually communicate with them. So I'm very grateful to you for doing that on behalf of the Institute and the communities that I work with. So thank you for that. And Clay, do you have any closing comments before you do the spiritual closing?
No, I don't think so. I think everything has been said. I'll just sort of echo everything. Again, I just personalize it. I was just thinking about when you were talking, when you're giving this wonderful, amazing talk. And I was thinking about, it's been a very difficult couple of years and for everyone, and challenging, and all the challenges that the communities had to face. And personally, I've had to face everything. I've had COVID. And I'm very thankful that there was a vaccine. I took the vaccine. It saved my life. It saved my wife's life. It saved my children's lives. And again, you talked about how skeptical, and I'll just say this personally, I was one of the very first people to get the vaccine because if I was my mother, who's an elder in the community, they offered it to the elders, and because I was in her bubble, so they said, hey, you should have this. And at first, like as you mentioned, I was like, well, wait a minute, do I really want to do this? This is like, hey, it's like, and then I realized, and I thought about it, and I said, I prayed about it, and I thought about it, because we're in this, and I talked to some people, professionals, Indigenous doctors, and they said, trust the science, Clay, and it made me think about, well, wait a minute here, this, like I've said this before, we have more, like Indigenous point of views, we have more in common with science than we do the religions, right?
Yeah.
Because everything's about energy, spirit, whatever you want to use, and it's all there, and it's just, and so I've been promoting that and talking about it, so I really had to dig deep and really look at that and say, okay, yes, I trust it, and I'm so grateful, because when I got COVID and it was just, and it was scary, it was terrifying, and all of this, and I was sitting there, my whole house got it, my granddaughter got it, she's 2, she had a fever, my wife got it, and we're all sick in bed, and I was just praying, but I also trusted, I knew that I would get through this. If there wasn't no COVID, if there wasn't no vaccine, I don't think I would be here. My wife wouldn't be here, because all of this. But again, go back to the beginning of when all this happened. It really, like, I got on my hands and knees when I remember that day, Suzanne, when you told me, you said, go home, Clay, just, and everything, and the reality of when we, when this whole pandemic started, everything, I still remember that day. I got home and I didn't, I was trying to tell my wife this, I'm trying to tell her everything, but I secretly, quietly, I got on my hands and my knees and I prayed, right? Not to take my children, not to take my loved ones, right? And I made a vow to myself that, I think individually, collectively, we all have to do this on our own, but I made a vow that I don't care who it is or who I have to talk to and who I have to, if I have to sit with my enemies, I'll sit with them to get us through this, the human beings. Do what I can to get us through this, right? Whatever I can do. And that was my commitment to myself. And that's what I hear here. That's what I'm saying. I hear that from you and everyone who's doing this, and we'll sit with our so-called people who are against us and everything, whatever their reasons are, and we'll get through this, because we're all trying to get through this as human beings. And that's the most important thing, right? And everything. So, and that was a commitment I made to myself, and it's been 2 years, and it's been a challenge because we're still, they're still not listening to us, and they're still not trying to hear us, and they're still, because they're caught up in their racism, the sexism, all of these things, and they're still, and we're saying, okay, no, we're here, and we want to contribute to this place called Turtle Island, called Canada, called all of these things, and Indigenous voices. So I encourage the youth to keep going, all of this. And we're not through this yet, but we're, there's some light. We're getting through this, right? So with that, I'll just end it on that and give it some thought. And again, thank you for this very thought-provoking talk and everything, and encourage you to keep going, everyone, right? So with that, I just want to say miigwech to all of you for listening, for taking the time to come here out of our busy lives. Everyone's busy doing their work. So I just encourage you to keep doing your work, wherever that is. So with that, I just want to say miigwech. I want to say thank you to the earth, the sun, the sky, and creation. And again, I humble myself. I just take a breath and just ask the blessings for each and one of us to come together. And may we always have this in our minds and our hearts. and to work for the people. I give thanks to you, Creator, for this day. And I say miigwech to you, all my relations. Miigwech. Thank you, guys.
Miigwech. Thank you, everyone. And please don't forget to take our survey. It's only take a couple minutes of your time. It's in the chat. Please click on it, and we greatly appreciate any feedback, and we will take it to heart. Have a wonderful afternoon. Masi Cho.